Thank you. And first of all, I would like to acknowledge that we operate on the ancestral and unceded territory of the Coast Salish people, including the territory of the Musqueam, Squamish, Tsleil-Waututh Nation. We recognize their ongoing contribution to the health and well-being of their community. I also want to express my respect and gratitude for the opportunity to live, work, and serve on this land because of them. It is crucial that we honor and support the right, culture, and history of Indigenous people as we work towards reconciliation and improving healthcare services for all of us here. And now it's truly our pleasure to welcome our 7 amazing speakers from industry today. As you can see on the very left, our event will be divided into 3 parts. And due to time concern and just to keep things, on schedule, I will let each speaker introduce themselves during their individual 3 minutes presentation in the first part. And then after that, we will have a 25 to 30 minutes panel discussion on the path to commercialization, the role of research in that journey, and potential partnership opportunity with our academia, moderated by my colleague Tibor. And after that, I will wrap up with a 5 to 10 minutes Q&A session. So feel free to always drop your questions in the chat. Tibor, do you want to quickly introduce yourself before we let Adam to start?
Absolutely, I shall. My name is Tibor van Rooij. I'm the Director of Research Informatics at the BC Children's Hospital Research Institute. I'm also an adjunct in computer science at UBC, and it's my very big pleasure to be here today. I will also be moderating the discussion after the presentations. I have been on both sides of the fence. I've worked in industry at TELUS Health, and I've extensively worked in academia as well.
Thank you so much, Tibor. Now the floor is all yours, Adam. Please go ahead and introduce yourself.
All right. Hello, everybody. Just want to make sure you can see my screen.
Perfect.
Yeah, awesome.
Yeah.
Okay. So hi, everyone. Delighted to be here. Thanks so much for having me. My name is Adam Hutton. I'm the Chief Operating Officer at Healwell AI. Healwell is a relatively new entrant into the Canadian health IT space, so won't be offended if you haven't heard of us just yet. We sort of came on the scene about a year ago, actually. And research and innovation is very much at our core of what we do. We actually have a very unique assembly of businesses and capabilities that help us accomplish this goal. And so I'm excited to tell you a little bit more, but I've only been given 3 minutes, so hopefully we can get into more details as the discussion goes on. And so the way it works is Healwell is the parent company, but the magic really happens at the individual businesses within our company. So we call these our business units, and we sort of bucket them into 3 main categories. First is our AI and data science stream of business. And so we've got 2 companies in there in Pentavere and Cure. And they are absolutely world-class when it comes to leveraging AI for the purposes of data science in health. And so as you probably know, 30% of the world's data is healthcare data. And 80% of healthcare data is unstructured, which means it's stuck in the medical record in the form of unstructured notes and PDFs and images and faxes. And what magic Pentavere and Cure bring to the table is the ability to take that unstructured data, make it structured, and then you can use it for clinical research by applying the AI capabilities. And so we can quite literally work through skyscrapers worth of data very quickly and compliantly leveraging the AI capabilities. Our second category is our healthcare software business. And so this is electronic health records that power governments and large health organizations like provincial health authorities and small hospitals. And they're very much what you would expect from an EHR. So they're the connective tissue that helps the health system operate. And then the third category in our business is the patient services and clinical research category. And so we actually own bricks and mortar sites where there are doctors working with patients. We recently brought, just this past summer, a clinical research organization called Biopharma into the family. And they've got a big site in Markham here in Ontario, where they are actually conducting clinical trials. And so as you can see, we've got the whole continuum from bricks and mortar with physicians meeting with patients through to the software that powers those sites all the way to the advanced data science capabilities. And one business that you probably have heard of being in BC is Well Health. And so we've got a very close relationship with Well. They're our largest investor, and we've got an exclusive strategic partnership with them, which allows us to connect with them and extend our reach to include the vast clinic network that Well owns, as well as their software products. So they've got the community electronic health record with Oscar. They've got Ocean, which is the connective tissue for e-referral, e-consult, e-ordering, which is currently being rolled out across BC and has been very successful here in Ontario. So that relationship's really important to us. And so we're just really excited about today's discussion because we're excited to bring these tools to the forefront so that we can talk about how we might be able to leverage some of these capabilities to support your efforts in innovation and driving research. So I think I'm probably over my 3-minute allotment, but excited for the discussion, and I will stop it there.
Thank you so much, Adam. And I think the second one is Duncan. Please feel free to go ahead.
Yeah, hi there. I'm Duncan Weatherston. I am one of the founders and the CEO of Smile Digital Health. Smile Digital Health provides a couple of key facilities. One is a data platform that's used in 23 countries for storing health information.
Duncan, we cannot see your slides if you had any.
I don't have any slides. I'm just talking.
Oh, okay.
Yeah, I'm just going to walk through what we do. So Smile is a data platform that's used in 23 countries to store information on behalf of mostly health systems, but payers in the US. Our clients typically include very large payers like HCSC, Centene, Highmark, UPMC, clients with tens of millions of patients. In Ontario, we're providing a data platform which is being used to roll out all of the existing registry assets. We're working with large healthcare systems in the US like Fresenius, Kaiser, and others to be able to store information and provide the ability to build clinical records. And then the second component, which is key to our offering, is a clinical reasoning component. And this uses a standard called clinical quality language, which is a mechanism by which clinicians are able to actually read queries and make a decision as to whether or not the content that they're reviewing is in fact reflective of either the quality measures or the clinical reasoning steps that they're interested in. And this is important because the challenge associated with making a decision about whether a particular query is effective is really driven by the clinical value of that request. If you ask them to read a bunch of SQL looking at tables with obscure names, it becomes very hard. So our solution enables this clinical quality language to be implemented against the data records that we store. This is being significantly enhanced by some behavior in the US from NCQA, who are their quality measures group. It allows us to be able to run quality measures for something called HEDIS, which is the way they evaluate quality in the US against our platform. So, we're growing. We've got a bright future, and hopefully we can have some interesting conversations today.
Great, thanks, Duncan. I believe Sally is having some issues or so. Let's proceed with the next presenter. I'm not sure about the order, but
the order is alphabetical by
okay.
first name. So Faten. Yes. All right.
Can you hear me now? Can you hear me now?
Yes, we can.
Okay. Sorry about that. I was muted. So hi everyone. Sorry, I wasn't aware that we were to have a presentation to share, but I could definitely speak to it. My name is Faten Alshazly. I'm the CEO of Healthy Me. Just briefly, Healthy Me is just a baby actually in the digital health ecosystem. We have been around for about a year and a half, actually maybe 2 years now. And it was spun off of my other company, the parent company, We As Them. And We As Them has been working for over a decade now in commercializing research, health research with researchers globally, and for now over a decade and a half. So Healthy Me basically is the answer to what patients do while they are waiting for their clinical appointments, either their first appointment or the follow-up appointment. While they wait, they continue to deteriorate. And our approach was to ensure patients had a source other than Dr. Google to support themselves. So we used evidence-based tools and AI and we built a platform that is now rolled out in almost 6 countries and supports a patient with a chronic illness across various levels of care. We started with mental health, and now we're looking at different chronic illnesses that are requested of us to build for. We have won a number of awards that I'm really proud of in this short time in our corporate entity, and are already recognized as one of Canada's top 10 most innovative businesses. And so thank you for having me, and sorry for the lack of the slides, but hopefully with the panel we can shed more lights on what we do.
Thank you very much.
Thanks, Faten. And I believe the next presenter is Joby.
Yes.
Hi there. Sally was going to share my slides, but do you want me to do that?
Yes, please do.
Yes, please.
Sally seems to have
some technical issues.
Yeah.
Okay. Yeah. Let's make sure this works then. Hopefully you're seeing an overview of Teledoc.
Yes.
Okay.
We are.
Magic.
Perfect.
Not bad for a technology company then. Why don't I go ahead and jump in? I'm Joby McKenzie. I lead the Teladoc Health Canada business. I'm going to share in fast 3 minutes what we do, how we do it, and who we do it with. So you'll hold me accountable, maybe not equally distributed amongst the 3 minutes. I too came from research, and so really passionate about, how do we support that in ways that is meaningful to Canadians. Across Teladoc Health, we support many different use cases, and in fact have been doing this for over 20 years, so quite proud of the types of work that we do, from supporting people healthy at home, but also sick at home. I think all of us would prefer to be at home. So many different tools to do that. Primary care, through to supporting emergency departments staying open, supporting patients when they're actually inpatients in the hospital, and then ongoing care, including chronic conditions, mental health, etc. So many different use cases, from the full gamut of experiences that Canadians have. And we do that by combining 3 different building blocks. The first building block is really leveraging our technology. So technology that is in the form of devices. So imagine that you're a patient in a hospital. This device would be sitting in the hospital, or platforms. We have a solo platform. In fact, many physicians across British Columbia use our platform. So really purpose-built for virtual care. So that's one category. The second category is clinicians, everyone from GPs, nurse practitioners, to emergency physicians, specialty care, etc. And then the third building block is care solutions. So this is really an application that patients can use either to get physical or mental health supports, programs that are also enabled by AI, like chronic conditions, etc. So depending on the use case, these different building blocks are combined in different ways. And where we do this, we've had the privilege actually of supporting Canadians for many years. Millions of Canadians have access to our solutions. And what's, I think, special about Teladoc is because we operate in over 175 countries around the world, we can call it the best of solutions that work, and localize them to meet the Canadian needs, which we know even across Canada is very special. Even across British Columbia, different regions have different needs. And I think that's really important as it relates to research and the things that need to be evaluated. Most importantly, we resolve health issues, and of course, powered by high quality and care. Different organizations that we support, not just across Canada. I'll talk through some of these around, Charité, which is in Germany, how that started as a grant and turned into a whole hub and spoke model of virtual ICU across Germany, to Saskatchewan, where we leverage our devices to support 30 First Nations communities across the province for pediatric care and prevent 63% of children being transferred out of their community. Newfoundland and Labrador, where we support primary care and ED and visits through, Mayo, Cleveland Clinic, other logos that you would recognize, but really just quite proud of being able to support patients and working with research and other organizations to evaluate impact.
Great,
Thank you.
Thanks, Joby. And next we have Matthew from TELUS Health. Matthew, I believe you sent the slides to Sally. I can share that for you.
Yeah, sure. If you can do that, and if not, I'll share from my end.
Okay, perfect. Can everyone see my screen?
Yes, we can.
Okay.
Awesome. Thanks everyone for having me today. So my name's Dr. Matthew Chow. I'm a physician and I specialize in mental health, and I have a deep and ongoing relationship with the healthcare system here in British Columbia. I was president of the Medical Association here in BC during the pandemic. I also previously served on the board of the Medical Services Commission in this province, as part of the public administration of our healthcare system. Next slide. So people often ask me, and I'll just be candid here, what the heck is a telephone company doing, being involved in healthcare? And so the short answer is, why not? And the longer and more elaborate answer is, it's because TELUS is actually about connecting people. TELUS has always been about connecting people, whether it's connecting people during the height of the pandemic and making sure that our businesses and our economy and our healthcare system would not collapse, and making sure that people could communicate with their loved ones, communicate with their doctors, and that public health officials could communicate and coordinate the responses with one another. But now it's also in terms of a direct response to the healthcare challenges of our day, and getting involved directly in healthcare and connecting more and more Canadians to healthcare providers. And one of the strongest personifications of that is our TELUS Health MyCare service, which is a publicly funded service that's providing help to hundreds of thousands of British Columbians here at home. Our clinicians are hard at work providing very vital primary care services to BCers, even as we speak. We're a modest company, 200,000 team members globally, and that's just our employees. If I include our clinicians, that's another 100K or so. So about 300,000 people working at TELUS to connect people all around the world. Next slide. So this is just a sort of blueprint of what our global impact is. We touch the lives of about 75 million people in more than 60 countries. We also are involved deeply in people's financial health. There's a division of TELUS that manages pensions and retirement funds along for like large public and private sector entities. And so we help with people's financial health, because we know that that's one of the core pillars of actually people's health, along with their physical, mental health. We do about 580 million digital health transactions a year. We have millions of virtual care members, and of course, many retirees and enrollees in our financial health benefits and pension management business. Next slide. We are a company that is on the move and growing, and this is sort of a timeline of companies and talented team members that have joined our organization and our cause over the years, and we're just getting warmed up. We're just getting started. The last two, 2022 and 2024, LifeWorks was hundreds of thousands of people and $2.5 billion. In terms of that group of cherished colleagues joining our family. And then the latest news is EAP Latina, which covers about 20 million people throughout Latin America, providing behavioral health services. And then Easy and Wellness. I need to brush up on my Hangul, on my Korean. Maybe I need to watch K-dramas on Netflix a little bit more, but Easy and Wellness is a South Korean behavioral health company and they've just recently joined our family after being very valued partners for a number of years. So we are growing and diversifying, and there's a method to this. There's a strategy behind this, and if we go to the next slide, I'll fill you in a little bit about that. So we're really evolving our approach to connectivity and healthcare in response to basically the most challenging health needs of our day. We know that healthcare access is a challenge, and you can always hear us talking about access, access, access. We think it's absolutely crucial we connect people better to healthcare. And in fact, Canada has fallen behind the OECD average in terms of Canadians' access to healthcare. We know that there's a heightened need for mental health support, and we're seeing that signal for mental health support even in places that have previously shown stigma to mental illness, such as the Asia Pacific region. We're actually seeing one of the strongest signals and cries for help in terms of mental health support from the Asia Pacific. And then finally, I spoke about financial health. We know that rising cost of living, inflation, interest rates is having a profound impact on people's health. And so we believe in making the impact that we can on people's financial well-being. Next slide. So there's a couple of key segments that we target. I won't get into too much detail about this, but we really think of people and our customers and clients and patients in terms of the five buckets. And in Canada, the public sector, health professionals, and you and I as consumers are probably three of the largest buckets. But behind the scenes, we certainly work in tight interlock with employers as well as the payers, which in Canada, of course, is the single payer system, but in other countries is a variety of payers. Next slide. Our overall strategy is about, I said connecting, and there it is. Number one, it's about connecting people to well-being and health experiences, and really trying to move the needle more towards preventative and well-being care as opposed to sick care and remediation care. Unlocking the power of data. We're not just a passive conduit for people's data. We really want to help people understand their own data, unlock insights from their data, help governments unlock insights from their data, and that's certainly a very important partner that we have as government. But really just turn from being a passive conduit into more sophisticated analytics and insights. And then finally, expanding our services and geographies, and that's again speaks to the timeline I showed earlier about how we are growing into different parts of the world. Next slide, and this will be my final one, I believe. And then you cannot talk about healthcare without talking about AI. So just to give you a little snapshot of what we're doing here at TELUS Health in terms of AI, we've got more than 60 automation projects underway, and we complete about 10 automation projects each month. And each automation project saves us upwards of 10,000 hours of human time in terms of like processing referrals, sending documents between a family doctor's office and a specialist's office, doing clinical billing. A lot of mundane stuff, but also increasingly a lot more sophisticated clinical tasks as well. If you add up the hours, it's just incredible the impact. And we are privileged because of our size to be able to partner with Google, Amazon, and Microsoft with their latest technologies and to leverage their technologies and actually co-create the future of AI in healthcare. And like I said, that's just for starters. So maybe I'll end there.
Thank you so much, Matthew. I'm back. Now I believe Sandy, it's your turn.
Thank you, Sally. So hello, everybody. My name's Sandy Whitehouse, and I am I'm a pediatrician. I actually have had a full career at BC Children's Hospital, and so I'm delighted to be here. And the company that we started is called Ticket Health. I'm the Chief Medical Officer. We've been around for more than a decade. We've had done work with BC Children's, 3 republished research studies, but I'll tell you a little bit more about us. So I had a clinical problem that I wanted to solve. I thought that our science was good, but that a communication in healthcare was lacking, and I thought that patients and families, particularly vulnerable populations, needed some support in their interactions in healthcare. So I'm trying to bring the human side back into healthcare, and also trying to support providers to improve their work, and for administrators and researchers to improve data and efficiencies. So our foundation of our company is to create digital empathy and to transform transactional relationships into trusting relationships. And I think in the digital world, this is becoming more and more important. We've done a lot of work on the heuristics of what makes a relationship, what works in digital, what is digitally empathetic, and have created some 4 pillars around digitally empathetic care. I think one of the important things as we move into AI, particularly around patient data, is that the accuracy of data depends upon patients feeling that they trust the system and are providing honest and robust data. So our company creates patient-facing tools and community-facing tools. We really have 3 main products. One is a digital front door, and we have a digital front door at Hartwood for the inpatient substance abuse treatment program at the Women's Hospital. We do screening with feedback, and we do wraparound tools and validated tools and interactive tools, so supporting people when they provide data, and knowledge transfer, so educational tools again for patients. In the back end, all the data is captured, and we have various means of getting patients access to the tools that we have. We have a full dashboard for reporting data. The work we've done has been we've been heavily engaged with research with over 30 peer-reviewed publications, and very proud that we have a global community forum where our partners work together with our platform to look at further innovations. The platform's in 35 languages. It's been integrated into Epic and into Cerner, and we are sort of looking now at measurement-based care as one of our foundations in mental and behavioral health. So I think that really the basis of where we're going is that we've really have a lot of evidence to show that what we're doing makes a difference in terms of higher response rates, increased efficiency, and higher fidelity of data. Most of our work has been in the United States in child and youth health, including primary care clinics and schools and summer camps, as well as hospitals. We have a long-standing relationship with Seattle Children's Hospital, and then as well in Australia. We have some small work in Canada, but our focus has been really with, our successes have been really with the United States and then across Australia. So I think I'll stop there. Thank you.
Thank you so much, Sandy. Thank you for joining us from Australia.
Yes.
Yeah. Okay, so Shaneel, you are our last speaker. You may go ahead.
Thank you, Sally. Just share my screen.
Of course.
Okay.
Looks perfect.
Perfect. Hi, my name is Shaneel Pathak. I'm co-founder and CEO of Xample. Xample is a digital health company based out of Calgary. And I often say life happens outside the doctor's office. And Xample is a data capture platform to record your experience for any health condition, for you to make better decisions, as well as contribute to research. You, as the individual, gets to keep and own all their data, and also Xample, but also it's a tool primarily for data capture for clinical research. And so we've taken the opposite approach of being a single purpose app for a particular disease and made Xample configurable for any physical or mental health condition, because often people have complexities which they want to report. However, researchers can configure Xample and customize it for a particular survey or journal, customize it for your protocol. To enroll a patient, either you can send them an email, or some projects allow patients to self-enroll with a QR code, and then there's an e-consent according to your study protocol that they could complete, which has been approved by research ethics boards. We also have integrated with technology reported outcomes, primarily wearables. And so people could bring their own device to your clinical research, and with that, record their information. But we also have integrations with other technologies as well. So what's our strengths? So our platform has been validated to be very sticky. So we have about PROS completion rates around 75 to 90%. So PROS are patient-reported outcome measures, and that from UHN that surpasses their institutional average with Epic and REDCap. It's decentralized and scalable globally. We have clinical studies that have the PIs in Calgary, but they've recruited people internationally, about 7 countries. Xample is also used in Nigeria, and we're expanding globally. All the data is encrypted and stored in Canada. We've been approved by, as I said, research ethics boards as a data capture tool. And I mentioned before that Xample, originally Xample started as a platform to help individuals be more engaged in their health. And then researchers saw that it's yielding a lot of data. And so we still stick to our mission of allowing people to own and engage their own health data for themselves. And so that's part of the design of Xample. Here's a list of data that we do capture. And I mentioned how we could do integrations. So we have clinical researchers in Edmonton who are looking at integrating Xample into Air Quality Index to get different data sets that's outside the healthcare system. We could also integrate with AI modules. We even had discussions about using Xample as a tool to get the patient data as an input to execute the AI model and provide a response back. So we're very flexible in that respect. Some of our projects and partners, we collaborate with many institutions across Canada, and I'll highlight 2 in my next slide. And so one of our strengths is that the platform has been validated for stickiness for engagement from the patients and also value to the individuals. At McMaster, they've come up with 93% have completed their tasks using the app, adherence rates of over 70%, and many people continue using the app for their own needs. So it's a platform to contribute to individuals who are contributing to your own research. At UHN, Xample is used for remote monitoring. Again, I think here I want to highlight, in interest of time, is the fact that the age range was from 25 to 93. And so it's designed to be very easy to use either by mobile or from web. The reports that are coming from them is that Xample, people see the value entering information because it improves their conversations with their care circle. And so it's another reason why Xample is very sticky. And so my ask, I'll take the liberty, is that we are expanding across Canada. We want to expand to institutions across BC and love to work with clinical researchers here who are a part of this audience. Thank you.
Thank you so much, Shaneel. Then I think our next part will be 25 to 30 minutes panel discussion, depends on the time. So I will let you to cover now, Tibor.
Yes. Can everybody hear me?
Yes.
Fantastic. I will first want to introduce Jonathan, who so fast took over when you fell away, Sally. So Jonathan, can you please introduce yourself?
Yeah, thanks, Tibor. Hi, everyone. I'm Jonathan Surgeon. I'm a business analyst with the BC Children's Hospitals Research Institute. I lead an innovations team under Tibor and the digital health program under Beth, who is not here in this meeting. We do a lot of things around data analytics and machine learning and artificial intelligence and whatnot to support the researchers with their research studies and developing applications and frameworks for the researchers to support their own research studies. So yeah, it's great to have different presentations from different industries and to see the different flavors of solutions out there that could potentially solve a lot of problems. And curious to see the questions Tibor has and the group has for this panel.
All right, thank you. And Jonathan, in his spare time, also runs a company, just so you all know, in security. So a question I have for everybody, and I love this group. There's so many differing solutions, and there's such a good overview of all the things digital and virtual health can accomplish. But what are some key elements that make partnerships between your companies and researchers or academia in general successful? I can go by everybody, or we can just pipe up if you have something to say. What is the preferred methodology here? Do we all want to give our input on each question? Let's do that. All right, Adam, you go first. What makes it successful if you work with researchers?
Yeah, I think where we've had challenges in the past is misalignment of objectives, because we as business operators, right, we need to make money. We have scarce resources that we can allocate towards that pursuit, and our objectives don't always align to the researchers' objectives. And so I'll lump public sector into the research category, which might not be fair, but we certainly get lots of people coming to us saying, hey, can you help us solve this problem? And it's an interesting problem, it's an important problem, but if it's too far from our core path, then it's a really difficult thing for us to prioritize. And especially in this system, we've got so many pilot projects, right? We dabble around the edges and we kind of prove it at small scale, but it doesn't necessarily have a business case that allows it to scale. And I guess where we've seen it fail is when it hasn't been on our critical path, and therefore we can't lean in with all of our muster, and therefore it sort of falls by the wayside for us.
Right. So being aligned, like having a common vision, and is important. Duncan, can you speak to this as well?
Yeah, sure. So our experience in working with researchers and clinicians and others in areas which are not directly associated with revenue, which tends to be the case with research. I mean, for the most part, the activity is critical for understanding or for science, but it hasn't historically been particularly remunerative in the early stages. And so what we found was that as long as we were operating towards a common goal together, where in the future you could see that there would be some benefit to others from the functionality developed on behalf of the application, or that there was some reuse that you could get out of it, or some learning that was going to help you with a different thing, it was quite effective. What we found was, and we've had a number of cases like this where we worked with partners who are very small footprint. We entered with lots of good intentions, but after a while, if you've got 50, 100 members participating in a study, that becomes relatively insignificant after a couple of years in terms of the overall attention of everybody involved. The researchers have moved on to other things. We've moved on to other things. There's kind of legacy piece of it's a legacy component lying around the place, and having both parties be engaged enough to continue driving value out of that has been challenging. So I think for us, the real win is having very focused objectives in the project that we're doing together, so that we are able to stay tied to the activity, and then having maybe a pathway forward or a decision at which point you're going to sunset. Most of us who have companies want to participate and help people with research. We're all interested in, we're in healthcare, right? We care about populations, we care about making people better, we care about all the things that are associated with improvement in quality of life for other people. So we're willing to take a hit on revenue if it does something meaningful, or we're also willing to engage in a pathway forward if there's some larger value prop associated with it. To be successful, you have to make a decision which one you are.
Right. So scaling, basically, you want to see a path to scale the research into a commercial application.
Or not, right? It can be something which is just interesting, willing to participate on the merit of the research itself as well. But it has to be a conscious decision.
Right, exactly. So both of you basically are saying clarity is important, and so that's interesting. Just a side question before I go to Faten. So, do you think that there is a translational issue, that you don't always speak the same language as researchers, that there's a communication issue there sometimes, or is it more of the alignment part that Adam was saying?
I can speak to that.
Yeah.
Having had a full career on both sides of the fence, I think that it's not just the language that's the issue. I think it's actually the infrastructure that often causes an issue, and the different stakeholders within healthcare organizations having different goals and priorities. So if one can line up IT and administration and the researchers as a unit, I mean, they're three big groups, then in other places we've had more success because they have different goals. So it's not only the goal of the company and the goal of the institution, the goals of the institution are multifactorial. And so, and an example is that we started off with the Foundry when the Foundry really was only just beginning, and we were never able to get onto the the clinic IT system. So our technology was running on the guest internet as a research project. It was really challenging for the staff.
So
So
operational buy-in is.
So there's operational buy-in, I think, is really important, and then finding goals with that can be helpful. And then I think the other thing that the others had said also is the priorities around whether this is a scalable solution after you've gone through your pilot.
Right, Faten, what are some key metrics you're looking for when you're working with?
Well, thank you. Along with everyone, like everything here is very familiar as you listen to it, but I always go for my first experience, which was a key driver for the success into this. Two of the very important key criteria is a very clear agreement on what the partnership entails for both parties or whoever the parties are. To start off, there is no doubt. I recall our first encounter, an example that I'll share in a second. I looked at the end of it was a 100-page document that entailed exactly what this agreement mean and what are the different roles and the objectives from each one and for each one. Transparently identifying what each gets out of this agreement is very, very important as well, and played a huge role in our work. A good example I'd love to share here is from my other firm that I was just speaking about in my intro, We As Them, which started us with all this work. We basically specialized in commercializing health research and knowledge mobilization for uptake by patients, families, and consumers alike. So we partnered up with an academic and a renowned researcher from Dalhousie University and TELUS Health. So that's for Matthew, that's very interesting to have someone from TELUS Health here. So it was that identification of what our role would be, what the researcher's role is, and what TELUS Health role is that made this a great experience. All three of our roles were identified.
Sorry, I just want to make sure in the interest of time. So what you're basically saying is clear agreements, clear roles and responsibilities, outlined a priori is what is. Joby.
I'm not going to repeat what others said. All very smart goals, clarity, etc. I'm going to actually pick up on a comment that Steph has in the commentary, and it goes back to for me, when you innovate, by definition, you're leading. And so when you're leading, I think it's really important that we're investing our time on the things that really matter. So like, what are the big rocks? What are the big challenges we're actually trying to solve versus doing things for the marginal use cases? I think that is unlikely to have a high ROI. I know your question, Steph, is like, how do we actually partner in a way that has a meaningful difference? It is interesting. And I think about, Teladoc Health, obviously we're literally almost in every country around the world, and we have been doing this for over 20 years. Yet it is interesting in BC, you ask about, well, give me the example in BC, give me the example here. And if we can't do it, then how do smaller organizations, like we're a multi-billion-dollar organization, and there's lots of hoops that you have to jump through. And so I do wonder, as it relates to partnerships, you can't solve for all of the risks. And when you're solving problems that are big, problems, I think you have to agree on what's critical to have. Like, is it that you need a use case internationally, you need a use case in Canada, you need a use case in BC, you need a use case in your specific health authority? And then sometimes you've evaluated all of the risk if you do, and I think we spend not enough time evaluating the risk if we don't, because there are big problems in healthcare in Canada, and I think so many willing partners that have so many great tools, and we just take so long of evaluating the risk if we do. And so, anyways, I just think there are lots of opportunities to partner to solve big problems. And then I think potentially we can get there faster, and potentially, having those proof points that might not be, to 17 decimal point precision, but good enough that is better than the risk of living with the challenges that we do.
Right. And so one of the things they are, yes, this resonates with me. And there is, for instance, there is people in security continuously worry about the safety of patient data, but don't put enough emphasis on the fact that not using that data to make healthcare better prolongs unnecessary suffering, because the diagnosis may be in there, the treatment may be in there, the way forward may be in there. And how do we translate that need to everyone? Because there's a lot of fear around entrusting data and working with companies, for instance. So yeah, the flip side of that is that we miss out on good things. And innovation is always hard. And it's also if you're innovating, you're very, very often the first one. So people ask you for examples as to what has been done, but you're like, well, I'm the first one moving here, so I have no examples. I'm moving right now, right? So Matthew, what is your view on this? Thank you, Joby.
I mean, to add to the great comments, by my esteemed colleagues, I think the key for us is we want to tackle the big problems. Like, that's why I work at TELUS. That's why 300,000 of my colleagues work at TELUS, is we want to tackle the big problems of the day. And when I think about what are the big problems of the day, in Canada, I'll just focus on our country for a moment. The CIHI just released a report, and basically CIHI said 17% of Canadians do not have access to a primary care provider, right? That's almost 7 million people that do not have access to basic, like, we're not even talking sophisticated specialist care, just basic primary care, do not have access. That is a huge and growing challenge, and it's something that we're interested in, and we're happy to partner with people that are equally interested and passionate about that topic, because it's big. And it's to Adam's excellent points earlier, we care about it as a company because obviously there's the commercialization aspect and the fiscal aspect, but the public sector cares about it too. And if you just look at the ambiguous result of the BC election that we just had, there was a clear number of British Columbians who signaled that they're not satisfied with how things have been going, and they want to change. And so, to the point that Anna raised in the chat, how can the urgency of the issue be more effectively conveyed? I think it is being very effectively conveyed at the ballot box, and we are seeing people pay more attention to this. So to summarize, if researchers want to see more alignment with industry, you got to work on the big problems. You got to be working on the problems that if you went to your neighbor, and hopefully your neighbors are not all PhDs, but if they are, that's cool too. I respect that. But go to your kid's birthday party. Go talk to your neighbors. Go talk to people on Main Street and ask them what they're worried about. And those are the problems that we work on. Now, I know I'm oversimplifying it a little bit, but really, when I boil it down, the ethos of our company from day one has always been to work on those problems that you could easily explain to your neighbor about why they're important.
Thank you, Matthew. I've worked at TELUS Health, and I very much enjoyed working there, so I know where you are. Shaneel.
Yeah, great comments. I think what I'll add is our experience working with, let's say, individual researchers. It's good for us to know where you are in the research life cycle. Are you identifying the research question, or you've submitted your ethics and you're ready to recruit? Because knowing your position in that process helps us assist you more effectively. And an example would be out in Ontario, one of the researchers, they shared their protocol, their information, and we were able to improve their consent form, give them ideas how to collect better data and more data, and more efficiently, just because you don't know what you don't know. And I say that respectively for both parties. And so when we were very transparent, we came up with a solution that was more effective, in order to be more successful. And so that's transparency, and vulnerability of where you are. That would, I think, further the collaboration.
Thank you, Shaneel. Are there any questions from the audience that they would like to ask at this point? I would like to open the floor on that. I haven't been. Hi, Jonathan.
Yeah, we have 2 questions in the chat. I think like 2 of them are not addressed. So at least in BC, the health data is kind of like fragmented, and there are a lot of policies that restricts the movement of data or even like an access to data. So a question in the chat was like, how do we approach this, and how are other like jurisdictions or other provinces approaching this in terms of digital health innovations, and how are they open to taking any like commercial solutions out there to address this? So that was a question in the chat. If anyone in the panel would want to.
Duncan, that's you, man. You're solving that, aren't you?
Yeah, so one of the things that Smile does is we try to normalize information to an international standard called FHIR. And so, we get information from all kinds of sources and make it available to the community that's got access to it. The issue primarily associated with the siloization or the balkanization of information in healthcare is largely about use case, right? The challenge is that the reason information is collected in general is for a particular purpose. And everybody in this call probably knows exactly what I'm talking about, right? It's collected for care, or it's collected for administrative purposes, or it's collected for research. And as a consequence, what we have is a fairly distributed construct in terms of the way information is accreted, stored, how terminology is used, how standards are used in general. If you think about the value sets, each of the use cases is a different value set. For example, the approach in general to health information has been entirely driven by application rather than by the health data model. And so I think one of the things that has been a real impediment to our ability to exchange information has been the character of collection. So the way forward, and the thing that we're seeing from the community, is a normalization on a set of data models. And so, in Canada, in the US and Australia and a variety of other places, we're moving towards this FHIR-based data model, but one which is driven primarily by these things called implementation guides. And if you take a look at the US, for example, US CDI is a good example of that, where it's a base data set. So in terms of how do we see the pathway going forward for access to information and normalization of that workflow, it's driven primarily by the fact that there is a broad recognition by governments and by the community that they do need access to this information, that it is worth going through the effort of standardizing and normalizing on well-established and well-defined data models, and then finding ways to do the exchange. And this is true in British Columbia, Australia, et cetera, many places.
Shaneel, and then I want to grab another question from the audience.
Okay. I'll be quick. I think there's a technical challenge. There's also cultural challenge. So one thing we do at Zamplo is that we commit that everybody, all the participants, gets to own their own data. And we've faced challenges from certain parties and institutions where they don't want to release the data of the patients. They actually tell us to delete all the data because the data belongs to the institution. It truly belongs to the individuals. And there is this, I believe, that there needs to be a cultural shift, that data is owned by the people, and if you allow them to own the data, you could get more portability, number one. And number two, privacy is used as a reason to not share the data. And I think it's more so of the risk assessment versus the benefit of sharing the data.
Right. That was the point. Better said. Thank you, Shaneel. That was the point I was trying to make earlier as well. So there's a question from the audience from Matthias who's saying, how do we fund these projects? Because getting research dollars is tricky, as even before we pass on funds to the industry partners. And how do we align timelines with trainee programs to meet expectations from with companies around timelines, needs, expectations, if we get funds, for instance, from digital. So there's these timeline issues too, right? Like if you look at digital, they want us to move really, really quickly. But the timelines of academic research and these programs are not well aligned.
I'm happy to jump in on that topic for a minute. I mean, it's interesting because sometimes we launch programs and want to evaluate, for example, quality or outcomes. And by definition, those aren't fast programs, right? So I do think that some of what we do, I think it depends on, are you doing the work for the purpose of research? Are you doing the work to solve a problem, and research can follow up to actually further validate the impact or the ROI, right? We spend a lot of money in healthcare. I mean, now billions of more dollars coming from the feds into the province without really any impact accountability on the money. And so while, of course, I'm passionate about doing better in healthcare, also a taxpayer, and I don't really want to spend 70 cents on my dollar for taxes. And so I think it's really important. So some of the work that we're doing in Newfoundland and Labrador supporting, a big proportion of their patients for virtual primary care as well as virtual ED. And so that program has been running for a year. And now we're talking about the impact on, some of the quality metrics related to, is it financially more prudent to support these programs, and what does that compare to, for example, not in person, but as part of the total system if these people don't actually have care, which is actually a problem that we have across this country, not unique to them. And similarly, how does it impact the workforce when you have a hybrid model? You have a bunch of the workforce now coming back in because it's more sustainable, and we're not only giving the absolute hard work to people. And so what's the lift on engagement for a very burnt out workforce? And some of those things, again, it's not preventing the programs from going forward, it's further validating that they're important, and then how do you continue to invest? And so those are long timelines, and I think really important questions to solve. And we have, willing partners. I do think it's important always to say, we share data, or, not always the data custodian, patients should have it. All of those beliefs are true. And we want to know that the way that we're providing care and support is having a valuable impact to Canadians, because it matters a lot. And I think those are mutually beneficial.
So what you're saying is transparency and accountability. Right?
I think some of the questions lend itself to longer term, which was your point. And I think there's all sorts of questions we can ask related to research. And I totally appreciate, companies need to not be handcuffed to move forward because there are only so many minutes and ways of spending your time that you can't, you can't die on the in the waiting room of research either.
For a very often uncertain outcome, right? When we write these grants, our batting average is 15%. Anyways, it is 1 o'clock now. People are going to start dropping off. I will keep this conversation going for another 5 minutes. But thank you, everybody who needs to run to their next meeting. Thank you for attending this seminar.
Tibor, if I could just sort of take Joby's comment and
absolutely
put a bit of a different twist on it. We've seen an interesting case study here in Ontario, how with this AI revolution that we're in the midst of right now, we obviously have tremendous opportunity to drive quality and capacity very quickly with some of the innovations coming down the pipeline. But of course, these technologies are met with so much skepticism, and it's hard for the health system and the users, whether that's patients or providers, to recognize whether or not they can trust the claims of these private enterprises that are claiming to have these perfect solutions to solve these huge problems. And so I wonder out loud whether there's an opportunity for the research community to kind of help validate that, right? To try to bring trust and credibility to some of these claims. And we saw it a little bit in Ontario with AI Scribe, which of course is transformative and actually like a pretty low bar in order to adopt. But it wasn't until the public sector, with the help of a research organization, did their study, quantified the impact, published the results, that then the whole community could take a big breath and say, okay, this is legit, this is for real, now we can do this, right? And if that's Scribe, we have 15 more layers that are way more intimate than chart notes, right? That's going to be clinical decision support. It's going to be predictive medicine. It's going to be, like all sorts of very important elements of the health system are going to be impacted by AI. And I feel like the research community needs to play a role in helping build trust and credibility where it's appropriate. Because as industry, we just like, if we say it, you guys are going to, not trust us, and that's fair and accurate, I would say. But if we had a partnership there, it might happen a bit faster.
Yeah, that the partnership part is also key. There was another question, like if researchers talk to businesses, what would the panel be more interested in? The research of this or the scalability, feasibility of your business? If I have 5 minutes with a potential partner, what information could open the door for another conversation? So when people contact you, we just heard your time is valuable. You can only do so many things. If researchers have an idea and don't necessarily, are well versed in speaking business, what is it that would pique your interest?
I'd like to make a comment. I don't think it's a one size fits all, Tibor. I think it depends, but and I think that as what Jody was saying, you want to have and Matthew, you want to have a big impact. So if a research project is got some very interesting innovation, but it is going to have a big impact, and it may not be a direct impact, it might be even something a bit tangential or has application to a broader group of people, then it's going to be more interest than a very specific defined solution for a very small specific, like that's very niche. So I think it's the scalability and the broadening of the concepts that would make a difference.
That's good feedback. Matthew, it looked like you wanted to jump in.
Well, I mean, I'll give you a little vignette into my day-to-day. Recently I was talking to Amazon, and basically they said to me, Matt, how would you provide behavioral health services to 1.6 million people in 66 languages? Like, that is the big problem I am trying to solve. And so when I talk to researchers and others, that's what I need to address.
So big issues, right? How do we? But very often in research, we create we create abstract models and then want to prove them in a small use case, right? Would that be acceptable? As long as there is a scale.
I think small use cases is fine, but an esteemed was it you, Adam, that said earlier, we're a country full of pilots, and a previous dean of the University of Toronto's Faculty of Medicine actually wrote a report about it. Right, we are the Naylor report. I think small scale is fine. Tests of change are fine. Proofs of concept are fine, but you've got to have a pathway to clearly scaling it up to make a meaningful impact on the problems that, like I said, your neighbors and the people at the kid's birthday party are going to care about, right? Because these are the things that Canadians are expressing to their political leaders right now, that they are concerned about, and this is a grand opportunity to actually make a meaningful impact and overcome some of the risk aversion that I commented on in the chat. And actually, to that point, I think a lovely opportunity for the research community is actually to measure and demonstrate the impact of not changing. We often talk about the risks of AI, the risks of this or that, or this new drug or whatever. We've very rarely measured the impact of sclerosis and failure to change. Like, how many people are being harmed by being on a wait list? How many people are being harmed because they don't have a family doctor? Right? How many people have died on a wait list? We don't talk about that enough. It's uncomfortable, but we need to talk about it.
And if I
Thank
can
you.
say,
Oh, sorry. I saw
sorry.
that you want to jump in.
It feels like as Matthew is saying my Healthy Me pitch basically, and that's where our model was built on, the long wait time that we have here in Canada and every province that started harming and affecting families and patients and potential patients. And I think we were very fortunate that we found a unique pinpoint that Healthy Me took off faster than what we could even imagine. And the interesting part, as with the success that we've seen across Canada with Healthy Me, and Matthew, I would love actually to speak to you more about it since we're sharing the same. As we took that and start traveling, the first problem in Canada is the length of the red tape. All the different bureaucracies and nuisance that we have to go through with every institution and every clinical unit. So we're redoing and we're starting from scratch with each one. Not that taking one working model and checking that box and speeding things up, but we're redoing it over and over.
That is
last year we were in South Korea, and I'll be really quick. Last year we were in South Korea, and within a month and a half, we had interest and adoption in our product. And the length, I'm not saying that skipping important areas that we need to cover, but the efficiency of how fast we skip that to get us to the end of it, to see how we can implement a really needed solution, even though the wait time not even as nearly as long as ours was.
I've heard this from Canadian companies before too, when they go to the US, that they get a foothold much faster and are able to move much faster in those markets. So that's an issue. So thank you everybody. This was a fantastic discussion. Thank you all for your time to be here. And thank you for sharing your thoughts and insights with our community.
Thank you, everyone. But just be mindful of time. We are really past 1 p.m., so I know it takes a lot of your time to join this seminar. So we really appreciate and hope we can have the opportunity to have you guys again, or maybe have a collaboration in the future on some of the research projects. So let's stay in touch, and thank you, Tibor and Jonas, to support me as well. We shall end this quickly.
Thank you, everyone.
Bye, everybody.
Thank you.
Bye-bye.